this, it's kind of nifty because you can open the cochlea and you can see that within the cochlea there are several chambers and structures. Okay? Now I'm not going to talk about them here because I have a better model for that. But you need to, and I'm guessing that you have I'm guessing you have an essay question. Has anyone looked? Is there an essay question about this hearing stuff? That's classic, so we'll talk about that in just a minute. But this is the cochlea that has to do with hearing. This bony part right here, again, was called what? Vestibule, and within the vestibule there are two membranous structures, okay? The saccule, okay, and the utricle. So it's very easy to remember. SUVs, right? Saccule and the utricle and the vestibule. SUV, saccule and the utricle and the vestibule. These saccule and utricle and the vestibule have sensory structures in them that have little hair cells, right? And they're covered by an otolithic membrane, so you have rocks in your head. And when you move, the rocks don't move as well as the gelatinous stuff that they're in, and that causes bending of the hair cells, which are mechanoreceptors that create electrical impulses that go out your vestibular nerve. Okay? So saccule and the utricle and the vestibule. So as I look at this, what is this right here? Oval window. Oval window, and what covers that?
Stapes.
The stapes. And so when you're hearing and sound waves come into your ear, the pinna funnels them in, it gets your tympanic membrane vibrating, right? And that tympanic membrane causes all these tiny little ossicles to move back and forth, and they amplify the sound. And then the base of that stapes, what does it do? It vibrates against that oval window, and what's inside of there? Fluid. And it gets the fluid moving, and that fluid is what ultimately will cause disturbances in your cochlea and you hear sounds. Pretty cool. Now, this is a closed system theoretically, right? And we've got vibrations, and somehow we have to get rid of them or have a release valve. And so what is the release valve? The round window, okay? Everybody see the round window? It's round shaped versus the oval window, which is oval shaped, okay? All right.
Where do they go?
It's connected to the middle area, okay? All right, now, what were these three bony structures here called? Semicircular canals. Inside of each of them is a semicircular duct. Okay, so you got to be very careful. If on the lab test I ask you the name of the gray structure, it is a semicircular duct. This is a semicircular canal. The pink stuff that's around the outside of the duct is a fluid called perilymph. Okay, inside of the duct is a fluid called endolymph. Okay. All right, perilymph and endolymph. Now, this widened part, anyone know the name of the widened part of this semicircular duct? The ampulla, okay? And there is a sensory structure in there, again with hair cells covered by a little jello covering called the cupula. And when you do this and the fluid gets going, it bends that jello and bends the hair cells, okay? There's a common theme here. All of the sensory cells in the inner ear are mechanoreceptors. They respond to physical forces. So you have to get things moving and they bend. Okay? So that's a good clue to remind you for lecture purposes. Okay? Now, let's go to the cochlea. Is everybody good so far on